Hi everyone and welcome to AusProEd. My name is Amrit and I'm super excited to take you on this journey to prepare for the AMC MCQ examination. Before we embark on this journey, it is very important to understand about the AMC MCQ exam fundamentals. The exam is for international medical graduates who are wanting to practice medicine in Australia. To be eligible for the AMC MCQ exam, you need to be an international medical graduate who has a degree that is recognized in Australia. So your primary degree like MBBS needs to be from a university that is recognized. You can go online and check if your degree is recognized by the AMC. Okay, so the AMC MCQ examination is a computer-based multiple choice examination, and this exam has a time limit of 3.5 hours. The exam can be done in many Pearson VUE centers worldwide, so you can go online and check which is the closest Pearson VUE center for you. There are 150 MCQ questions, which are A-type MCQs. What that means is that there's one correct response from 5 options. The goal of this exam is to test your medical knowledge across medicine, surgery, obstetrics and gynecology, pediatrics, psychiatry, population health, and ethics. The questions are formatted to test your medical knowledge and clinical competence. The MCQ questions focus on basic stuff, guys. So these are, like simple things across a wide range of topics. Through these questions, they're checking if you understand a disease process, if you're able to do a clinical examination, if you're able to reach a basic diagnosis, and if you are competent enough to order the correct investigations, and of course, simple management. So keep in mind, this is at the level of interns, okay? Not a specialist, but an intern. So for example, say that, you've got a patient in ED who's coming with chest pain. Which of the following is the best investigation to order? So options are FBE, UECs, LFTs, option 2 spirometry, option 3 X-ray, option 4 ECG, option 5 CTPA. So the correct response is an ECG in order to exclude life-threatening chest pain causes. So this exam is at the level of an intern in Australia. So you will need to familiarize yourself with the Australian healthcare system, the common diseases in Australia, Indigenous health, and the support that's available for preventative health in Australia, such as immunizations, dietary guidelines, communicable diseases, education and awareness campaigns, population-based health screening programs for things like national bowel cancer screening, breast cancers, or cervical cancer screening. The exam will also test your judgment when it comes to professionalism, ethics, and the law. Some questions will be very basic and straightforward, whereas some might be interpreting results of ECG or X-rays or CT scans. They might show you clinical photographs or other visual materials and make you pick the correct option. In this exam, there are 150 multiple choice questions which you have to solve in about 3.5 hours. The exam is delivered as a CAT. So CAT format means CAT, Computer Adaptive Test, in which basically each candidate has the first question, which is a randomly selected question from a pool of questions. If you answer the first question correctly, then the next question on your screen is harder. Alternatively, if you answer the first question incorrectly, the next question is less difficult. The process is continued and the exam goes on, and after the exam ends, the response is calculated. It's the computer that calculates the ability estimate score based on all the information that's available and obtained to that point. So you will get a pass or a fail score at the end of this exam, and there are a few strategies for answering A-type MCQ questions in which there's 1 out of 5 correct. So each question is testing you in different ways, and sometimes it can be that you're required to select the best response to the statement. At times the question is testing which is the next best step or the next best investigation to order. The candidate most importantly should read each question very, very carefully to understand what is being asked. Make sure that you're able to comprehend the question and eliminate the options that are incorrect, and at the end be confident that you have selected the option which is the most appropriate. At times, you will be asked to interpret images, x-rays, ECGs, or other diagrams or photographs of skin lesions, and in that case, the candidate is required to find the best answer. In this exam, each question has to be answered before the next question appears on the screen. So please keep in mind that once a question has been answered, a candidate cannot go back and change that. So be very careful on what you're doing. So that's AMC MCQ. Guys, success is not an accident. It's something that is created, and honestly, preparing for the AMC MCQ is not a joke. It does require a lot of dedication, effort, and discipline. I'm not a medical graduate of some fancy top-ranking university, but I'm here done and dusted with these exams. So if I can do it, then so can you. These exams are something that can be achieved by anyone, provided you're not afraid to put in the hard work. Please, please, please follow your dreams and do not hesitate to go on the AMC journey. Life is super beautiful once you start working as a doctor in Australia, and this goal can be achieved by any foreign trained doctor who wishes to migrate here. This reminds me of one of my favorite quotes from Nelson Mandela. It always seems impossible until it's done. The recipe to success is very simple. I have 3 principles which I preach to everyone. The first one is set your target. So set your target of passing the AMC exams and be specific on which date you intend to pass the MCQ. Keep in mind that you do need at least 3 to 4 months to safely prepare for the exam. This is an expensive exam, so there is a bit of a cost involved. So keep your target in mind and always focus on this, visualize this, meditate on this, as it will give you the strength to keep going and keep you away from all the distractions. To help set the target, you can also book your exam, and that way you know that there's no escape. The second principle is make a plan. If you don't have a plan, guys, you will not get anywhere. There's so many distractions that exist. So if you don't have a plan, you can be sitting there watching TikTok videos for like 2 hours and then wondering, what did I do? So make a plan on how many hours you will dedicate each day and break it down to the hour or to the minutes on what topics you're covering, and have a proper schedule plan for your study time. Planning leads to 50% of success, and putting in the effort is the other 50%. So make sure that you've got a solid plan. Principle 3 is dedication. So put in the consistent effort day in and day out. The man who moves a mountain begins by carrying away small stones. And perseverance is so important. Success is no accident, guys. It's hard work, perseverance, learning, studying, sacrifice, and most of all, loving and enjoying what you're doing. So make sure, you make it fun. Make it a fun journey. Be curious while you're studying. You're learning new stuff. So make sure, you have that little curiosity and pat yourself on the back for putting in the effort. And I'm here to support you on this journey and happy to answer any questions or queries that you may have about becoming a doctor in Australia. And trust me, don't waste your time. Make sure that you make up your mind, and if this is what you truly want to do, then dedicate your time and get to it. I wish you all the very best in this journey, and trust me when I say that if I can do it, so can you. You can do it.